And I think the biggest issue there is, are you concerned? As sometimes we get concerned given the current political climate that the Affordable Care Act will be weakened or repealed either before the end of your term or in the next term. What are your feelings about our commitment to that program and to the drug rehabilitation part of that program? President Obama, well, first of all, as with Kerry, I just want to thank you and your wife for sharing your story. And you're right, if you are a parent, then listening to Kerry or listening to you, you can relate. I told somebody one of my favorite sayings I ever heard about having children is it's like having your heart walking around outside your body. All you care about is making sure they're okay. But they're so vulnerable. And you're just as a parent always navigating, just trying to figure out how do I make sure they're going to be okay. And when something like this happens, and I think it's something that you sharing your story, Kerry, and you're sharing your story, sir. Really emphasizes this is happening in families everywhere with great parents who love their kids. Obviously there are a lot of kids who are in less stable homes and are more vulnerable. But the way this kind of phenomenon is penetrating all communities means that we have to understand that there is no us and they here. There is no us and them. This is all of us in every school. In every community, in every neighborhood. And it could be your child. So I think the first thing to do, and this conversation has been so helpful, is to Understand that this is an American problem that cuts across groups and political affiliations. Because once we understand that, then I think we're in a position to deal with it. Together as opposed to turning it into another political football. That's point number 1. Point number 2, one of my goals when I came into office was for us to restore a sense of balance when it came to dealing with drugs. And this was true for illegal drugs, but it was true for legal but overprescribed drugs. For a long time our goal has been to deal with the supply side. And as the chief said, we're very aggressive. I promise you, there's no backing off us trying to make sure that some Mexican heroin cartel is not getting heroin into West Virginia or any place else in this country. And we've got a lot of terrific agents and border patrols and officials. We have ramped up aggressively, under my administration and under previous administrations, interdiction efforts. So we don't stop that, and we don't make apologies for that. And if there is somebody who is out there systematically making millions or hundreds of millions of dollars off the destruction of our kids, we're going to go after them. We don't apologize for that. But we were underinvesting, and even with the changes we've made continue to underinvest in the demand side. In the prevention and the treatment that is so necessary. And this is a real opportunity. It's an important moment for us because if we can start thinking intelligently about treatment on the opioids and prescription drug side, Then people start making the connection, well, we should have treatment when it comes to heroin, and then maybe they start thinking, well, we should have treatment when it comes to other narcotics and drugs that are affecting and devastating families potentially in different ways. But for a long time I think treatment was seen as a second class. Citizen to interdiction and arrest and incarceration. And that mindset needs to change. The good news is we're seeing that mindset changing. And it is on a bipartisan basis, which I think is really interesting. To go back, because I want to make sure that people understand we're putting an end to the old politics on this. Democrats and Republicans were both responsible for wanting to look tough on the war on drugs and ramping up incarceration. It wasn't just one side or another. And now both at the same time are realizing, you know what are we doing here? Why is it that we're willing to invest $20,000 a year in incarcerating a young person when we might have spent a few $1,000s on the front end to avoid them going to prison in the first place? And that mindset means that resources hopefully will start channeling in a new direction. But we've got to make sure that the money is following the inside. I think we're at the stage now where people are starting to realize that we need more treatment. But the budgets are not yet reflective of that awareness. And that's going to require Congress. So in our budget, for example, we're proposing an additional $133 million for enhanced treatment and prevention programs. But it's also going to involve states, state legislatures. Counties, local governments, all also recognizing this is something that every community needs. And we can't be stigmatizing this. Having a treatment facility is just like having a health clinic. For any other illness because it's affecting people just as much. And we know how to do this when we do it smartly. Think about smoking, and I can say this as an ex-smoker who still chews on Nicorette, which is okay. It's expensive, but I can afford it. And Nicorette is, or nicotine is, as addictive as any of the drugs we're talking about. So if we could do on that with the public health model, there's no reason we can't do it here, as well. But it does require a change in mindset. And as you pointed out, it requires additional money. Last point I'll make on the insurance side. You are absolutely right that insurance coverage is not enough. If there is no treatment center for you to apply that insurance, so we're going to have to build and fund and support more treatment centers locally. On the other hand, if there is a treatment center and you don't have any insurance, then you might have to mortgage your house. And I am very proud of the fact that the Affordable Care Act, also known as Obamacare, which I mean I won't get on a soapbox here. But there's 17 million people who have health insurance who didn't have it. And by the way, our overall costs for healthcare have been going up at the slowest rate in my lifetime after we passed the law. So it's not bankrupting the government, not bankrupting states. But one of the things that it does is it requires that insurance, private insurance, that's sold on the marketplaces that are subsidized by the federal government have to provide coverage. For substance abuse programs. And given the prevalence of what's happening to our children and our schools, the notion that we would not have our insurance policies cover this, they're going to cover a broken leg. But they're not going to cover a situation where your child might die. That doesn't make any sense. And so I think that we're trying to nudge that along through the marketplaces. But I think one of the things that we need to do is to have consumer groups and our medical associations and others really push a little bit more on the insurance companies. To say that this is something that is vital, and that everybody should have coverage. Because you don't know if it's going to be your child. And that's the most important point here. Carrie is carrying a particular burden. And I was most touched when Carrie talked about her other children. But I thought about Malia and Sasha. They're wonderful girls, but they're teenagers. They do some things. But thank you for sharing your story. MS. Shoemade, this was from Natalie Laliberté, who is a principal at Ruth Lawn Elementary School. And she says, as the principal of an elementary school, I see the harm being done to kids who are born addicted or live in traumatic and chaotic drug environment. Many of the kids have any number of learning and behavioral problems upon entering preschool and kindergarten. How can the community at large and schools work together to intervene in these? Children's lives during their early years when brain growth stimuli is most critical? Thank you. President Obama, well, I'll make sure to get the doctor involved in this one, as well. And I know that Sylvia and others through HHS were working on this a lot. I'll just make 2 quick comments. Number 1, we know that you learn more between the time you're born and 3 years old than you will ever. Learn the reset of your life. You are a sponge at that age. And so the more we can invest in early childhood education, prenatal education for parents, home visitation with at-risk moms. And we know who they are. If you're a poor teenage single mom who maybe doesn't have a lot of support, then you are just much more likely to not know how to express the love you have for your child effectively. Even if you love them just as much as we love our kids. But you just don't have the tools. So that has got to be an emphasis at the state and local levels. That's where we can really make a difference. But us being able to target at-risk parents, new parents, young parents, that can be extraordinarily helpful. The second thing that I'll just say, and then maybe, doctor. You might want to chime in on this, and here I'm going to be a little controversial, but I'm in my last term, I only got a year left.